You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
The testimonials appearing in this podcast reflect individual experiences and individual results may vary. Cardinal Health does not claim, nor should the listener assume, that any individual experience recounted in this podcast is representative of what another consumer may experience.
The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Callori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts.
Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I am your host, Jason Callori, and today, that's right, we are living among legends. That's right. I'm not speaking in hyperbole. Today on the podcast, we have with us two 2025 Cardinal Health Community Leadership Award nominees to share all the amazing things they have done to be pillars of healthcare and small businesses in their respective communities. We will also dive into what they have done advocating for independent pharmacies from a state and national level. Listeners, please welcome our 2025 Community Leadership nominees, pharmacist Ken Tai of 986 Pharmacy and Jessi Stout of Table Rock Pharmacy and Compounding. Welcome to the show, esteemed guests.
Thank you. Thank you for having us.
Hi, Jason. Thank you for having us.
Nice to see you guys again. I know we're a couple months removed outside of Denver, but how is your community leadership? How was your whole experience, and how did everything happen for you at RBC? How was that whole experience, and how did your teams and mainly your families react to all of it?
So I didn't have quite as big of a team there as Ken. It was me and my husband and our two kids. But luckily my parents got to come out as well. It was exciting because they actually started our pharmacy. So it was really cool and special to be able to have them there. It was a huge honor just to be just nominated for the award. So we thank Jason, our sales rep, for that. But then to make a finalist with two very impressive pharmacy owners from across the country was a huge, huge honor. So it was really neat to be there and to meet them and just, share that experience with other pharmacy leaders.
How about you, Ken? You had a few people with you, just a few.
Just a few. Well, to be honest, we always have a pretty good showing to RBC. So typically we average about 40 to 50 individuals that attend that event. And so obviously this year was a little extra special because they also got to come out and celebrate the nomination, which again, I was hugely humbled and honored to receive, along with, of course, Jessi and Mike. So, and in all honesty, it was a surprise, and it was fun because typically I'll have my family out as well. So just like a little extra, kind of motivation for them to come out and have fun with the rest of the group.
For sure. So Ken, while we start with you real quick, I just want to kind of get into about your journey into the pharmacy profession, why you chose to become an independent pharmacy owner, and your specific community that you serve. Your story was incredible. We obviously worked on the entire almost documentary film like content that we had created for people to see at RBC. And I think it hit a lot of people, in the heartstrings, and also was very motivating, the same with all of you. So Ken, why don't you start there? I just want to know what your journey to the pharmacy profession was.
The journey was, I'm sure, like many, I'm, of course, very new to the healthcare industry. And so, like most, had experience working in a local pharmacy, fell in love with it, and decided that was something I was going to do. As a matter of fact, going into pharmacy school, I didn't really know what anything else but independent community pharmacy, would be like, because that's where I had worked in the summers and made deliveries and et cetera. So that was really the goal. So after coming out, did a quick residency in community, and pretty much a year or two later, after I saved up as much money as humanly possible and ate cup of noodles every day, I was able to muster enough money to start my first location in a small town, El Monte, California. That sprung into sort of a in a few years a franchise model, which we then opened more stores. And I guess it's about 19 and a half years now, and we have about 50 locations throughout Southern California and Nevada. So it's been a fun journey. And I think the more important thing for me was that I was able to utilize this platform to allow other young, pharmacists that want to have a career in entrepreneurship and in community, be able to utilize that as a platform to also become junior partners and be a part of this fun journey with me.
Jessi, what about you? I know you mentioned your pharmacist, your parents kind of starting the pharmacy and you kind of following in those footsteps. Was that something always kind of ingrained in you, or as you grew up and got a little bit older, you pretty much knew that's what you wanted to do?
So actually the opposite.
Okay.
So I did, I worked in the pharmacy as a teenager, on the cash register and that kind of thing. But I always said I was not going to go to pharmacy school. And I was definitely wasn't going to move back to my hometown. And definitely wasn't going to ever take over my parents' pharmacy. But, I went to college, I went to UNC Chapel Hill and was undecided major for quite some time. And, it ended up just, applying to pharmacy school because I was running out of time. I was a junior, didn't know what else I was going to do. So when I got in, I was like, well, maybe I'll just give it a go. But felt convinced I was going to do something kind of non-traditional. Did a rotation in London and in DC at APHA and really liked those non-traditional options as far as pharmacy goes.
Mm-hmm.
And then I actually had a preceptor in my fourth year of pharmacy school, and he convinced me to do a residency. It's actually inpatient hospital residency. So I did that and ultimately kept in touch with that preceptor. He found a new job at a company called Premier in Charlotte, and he actually had an opening. And so I actually, straight out of residency, went there and did what I always thought I was going to do, non-traditional. And worked with a pharmacy software product, traveled all around, trained hospital pharmacists on how to use it, and did really appreciate that opportunity and enjoyed that job, worked there for many, many years. But fast forward, we had a couple of kids. We were traveling back to my hometown, which is Morganton, because we have a lot of mountains, lakes, hiking, that kind of thing. And around the same time, my parents were looking to retire. So they never pushed me into it at all. But they were just like, hey, if you want to take over the pharmacy, this is your chance, because, we're ready to step down and enjoy our retirement. And so it was a huge change and a huge leap of faith, but we decided to move back to Morganton, even though I said I never would. And I decided to start working in my parents' pharmacy. And I was so nervous that first day because I hadn't been a practicing pharmacist, since ever, really. And so I felt like I didn't really remember anything, didn't know anything, but I loved it. Like, I loved the patient interaction. I loved, working, with the coworkers. And so fast forward, my husband and I decided that we'd give it a go. So worked here for all of a little over a year, I think, and decided to buy it in March of 2019. So that's how we got here.
Well, the two of you, so you guys obviously took a couple different paths, but I think the one thing we took from, obviously with you guys being nominees, was how much you've impacted your communities that you serve and how you've really built that trust within your community. And I think you two go about it in different ways. You offer different services, but you still have that core belief in, building up your community and obviously caring for the people within your community. Ken, I'll get your take on this. You've done a lot of different things within your pharmacy and within the community. You have a very unique clientele and the people you serve. Get into a little bit about some of the things that you've done to build up the trust within your community.
Well, I mean, definitely, open my own pharmacy community was definitely top of mind. So, even in the name itself, 986, it really is living in Southern California, we're very kind of multicultural, right? Very diverse community. And so the word 986 itself was partially because of the fact that most of our community members don't speak or read English. So having a number, then whether you speak Spanish or you speak Chinese or Korean or Vietnamese or Russian or Armenian, it was irrelevant. You could probably understand a number, 986, and you could say it in your own language. And so that was part of the reason why we did it. And of course, we do tailor to elderly, so they don't have the best cognition sometimes and ability to remember. So 3 numbers was supposedly the easiest way for you to remember something, or 3 digits or 3 letters. And so that's kind of partially why also we selected the name that we did, besides the meaning, of course.
Yeah, that's pretty brilliant.
Well, thank you. I need to thank the guy who helped us do the branding. No, but definitely I thought it was a great idea. And so on that front, that's really what it's about for us as a company, is really serving that community, a lot more in underserved area. So, all our pharmacies, anyone they go to technically would be specifically designed for that community. So they're in a Hispanic area, it would be 986 Farmacia. And then everyone there would speak Spanish. Everything there is like you walked into Mexico or Spain or whatnot. And so it's tailored specific to those communities. And so in doing so, we were able to then, of course, eventually venture into the homeless population, which is unfortunately a big problem in Southern California. So we had a homeless outreach in our nonprofit where we actually had boots on the ground. Basically, every day they would walk in with like a little tote. It's almost like, rolly tote, and they'll walk through the streets and the camps and the various areas where you see the homeless and tents and stuff, and they'll just basically provide services under a full protocol. Sometimes we have patients with scabies, patients obviously need vaccinations. The list goes on and on in terms of different types of services that we render to them. And it's basically a daily thing. So we've done this for the last few years. And of course, during the height of COVID, we provided vaccination services to the community, and we were actually rewarded by the CDC. Mandy Cohen, she came out and we were given a service award because supposedly we were the highest vaccinator for COVID in terms of the counties in LA County, which I'm assuming is probably one of the largest counties in the country. So it was really a huge honor, and I actually got to vaccinate her to promote vaccinations, and so it was one of the coolest things.
Wow.
Times and everything. So. Yeah, I mean, we try to do whatever we can because it is very important for us to do whatever we can. And I've always said that it's not about us telling the patients what we want to do to serve them. It's about them telling what they need, and we just walked up to their level in terms of what they want and what they need as a community. So that's always been sort of our goal. That's what we've done for the last, ever since I've opened my store, my first location. So we try to stay true to that.
Oh, yeah, that's amazing. What about you, Jessi?
So I was fortunate, that my parents had started the store. They started in 1990. So they had already done an excellent job of, building up trust in the community. And so, we just had to kind of fill those shoes and continue to build upon it. And COVID, while it was extremely hard for everyone, it also brought a lot of new opportunities for pharmacy. And during that, as there was so much misinformation out there. And so quite frequently during COVID, we would make like short little reels and put them up on our social media accounts to give our patients and their community truthful information. And so they knew that they could come to our sites and find out the factual information. And so our patients really appreciated that. And we, also provided information to providers in our area too. I frequently would like fax them updates, like COVID related updates, and then it evolved to other things as well. But, having the trust of the providers then, is relayed on to their patients as well. And so I think just having kind of that entire community trust has been important. And I've also built a relationship with a couple of local reporters, one for our local paper. And he will frequently reach out to me for input on various things like, how are the tariffs going to impact drug pricing? And he's done really great at covering PBM issues. And so a lot of people in our community still get the paper, the printed paper. And so, and I do too, and I love it.
Yeah.
But so our community member, like our patients, will come in all the time, and they're like, "Oh, great article in the paper. I really appreciated learning about XYZ, whatever it was." And so, really, just being a source of information, I think, has helped to build trust in our community.
That's a good one. I don't think I've heard that one yet, of people reaching out to local reporters and media outlets in order to get the word out, especially what's going on within each and every community. Ken, I'll go back to you on this, and Jessi, obviously, I want you to answer this because, we ask this question a lot, basically like, what does it mean to you to be an independent pharmacist? Why does it feel it's important to you? And I feel like we get a lot of the usual answers where, obviously, pharmacists, it's kind of ingrained in you to want to help people and to serve and to be that pillar of healthcare within your communities. But I think I want to just kind of shift that question a little bit and ask you, what does it mean to be an independent pharmacist in your community now, like in today's times versus then? What you're able to provide now and what you're able to do in your communities, what does it mean to, and what you've done as well, because you guys have done so much. What does it mean to be an independent pharmacist now in today's times in your communities? And Ken, I'll start with you.
I'll be honest. I think the healthcare industry is extremely difficult to navigate in today's world. Probably much more difficult than it's ever been. Very confusing, and quite honestly, for me, we're just an extension of that, where we can serve as the layman body that they can go to, the friend that they can respond to and talk to about all those issues. I always tell my team that just because you're a pharmacist and you can tell the side effects and what the drugs are doing for a patient, it's not that big a deal, because I can go on ChatGPT and get that pretty quickly. It's the relationship that we build and understanding of where they come from and what their needs are that really differentiate us from anyone else. So when they come to us, they're not just asking about, if a patient's been on atenolol for the last 20 years, do you think they need to know about the side effects? And they probably know it better than I do, to be very frank with you.
Yeah.
So what am I really doing? I'm really there because I'm a resource, right? They have questions about other healthcare situations, or they're lost in the system where they don't know what's going on with their insurances, or they can't, get a hold of their provider. And we serve as that liaison, that triage. So I think we're more of a resource, healthcare resource center, somewhere they can go to and access information quickly and readily. I think those are the things where we really prove our value. And I think that anyone that's been in independent pharmacy knows that the relationships that we built with our patients go far beyond that of just medications. These folks look at us as friends, as extensions of their family. I'll share a quick story. A patient of mine, I just went into the pharmacy maybe about a month ago, one of my original locations, and I was talking to my staff, and they gave me a picture of this magazine I happened to be featured in almost about 18 years ago when I first started my pharmacy. And there's a little note there that says, "Thank you." And I was like, "What is this? Oh my God, this is from like ancient history, for God's sake. Why is it here?" And I looked god awful. It's like I looked like I was like 10 years old. But anyways, I told them that, "Hey, this is disgusting. Why just put this away?" Go, no, this is from our patient, XYZ. And I was like, "Oh my God, how's he doing? I haven't seen him forever." And he goes, "Yeah, he just passed away." I was like, "Oh my God, why is this here?" He goes, "So the son was cleaning out the house, and before, they were throwing things out, and then they happened to have this magazine, and they brought it back to give to our staff, to give it to me." And I was like, "Well, why did he bring this back? He could have just tossed it or whatever." He goes, "No, this has been on my," so according to the patient son, this has been on his coffee table for the last 18 years.
Wow.
Every time anyone would come over, family, friends, and everything, he would boast about the fact that, "Hey, look, this is my pharmacist, and he's famous. He's on a magazine." Right? I'm not famous. But,
oh my God, I love that so much.
And then he would tell everybody, and he was so proud of it, and then everything until the day he passed. So even though their kids didn't really know me, they knew who I was, and they were, somehow connected to me in that way because of their parents. And then so when he passed away, they basically said, "Hey, I never had a chance to really thank you or even express how I felt, because we were so busy going about our business. We didn't really have time to take care of our parents, but apparently you're the extension of that and took care of them for us." Yeah. And so for that, I really want to thank you. I couldn't honestly throw this away. I really had to come back here. And even though, it wasn't much, it was just a little thank you, yellow stick-it note. It meant a lot because number one, I was personally connected to that patient. But second of all, to know that the impact that I had, even though I didn't really think too much about it, was so significant, And so that's really what this is all about.
Yeah, you said a couple of different things that I love there, especially when it comes to, I think the missing word there is trust, because as you alluded to earlier, you could go on, ChatGPT and look up an answer. You can do a mail order or whatever it may be, but you lose that trust. It's a trusted source, which you guys provide, especially now. I think that's a great point, Ken, because the healthcare landscape is so overly complicated. You guys are that sounding board for that trust that they need. Jessi, I'll add the same question to you. How do you feel about being a pharmacist in today's times?
Yeah, so I completely agree with everything Ken said about, the patient trust and that kind of thing. And one, thing I really try to do with our pharmacy students as they rotate through is just teach them how much you can do as a community pharmacist. Because a lot of times it kind of gets a bad rap, you just put pills in a bottle, that kind of thing, but we can do so much more. And the patients, everything that Ken said, they trust us, they rely on us. We help them put on their Dexcom meters for free. But also we can provide so many services, especially in North Carolina. We can now prescribe birth control for patients. We can give long-acting injectables for patients. We just got a bill passed earlier this year where we can test and treat for flu. So we've, throughout COVID, we did the COVID testing. We actually do flu testing as well. But now, starting October 1, we'll be able to write scripts for like Tamiflu. And so it's just exciting because pharmacists can now do so much more. I mean, it is state dependent, but a lot of states are broadening scope of practice for community pharmacies. And that's important for a number of reasons, primary care shortage. We also get patients in and out quick. It's also a lot cheaper to come to us for a COVID flu test than it is to go to urgent care. And patients, they just book an appointment online and call us when they get here. We run out the back door and swab them. They're in and out in 20 minutes, with their results. So I just think it's, while it is extremely challenging with all of the PBM issues and roadblocks, we do have a lot of opportunities that we didn't, maybe 5 or 10 years ago.
Yeah, that's great. And actually, Jessi, I want to stay with you because this leads me into both you and Ken do a lot of things outside of the walls of your pharmacy, the impact in your community that goes further. Jessi, you had mentioned some pharmacy students that come, through your doors that you help out and talk to. Tell us about, your role as a community health educator. I think it's a big part of what you do, specifically at your pharmacy. Tell us about the level of health literacy in your area, how your efforts have impacted patients, their knowledge, and the ability to manage their own health.
Yeah. So health literacy ranges widely here. I actually found out one of our patients last week can't read. And so that's his wife always took care of him and his medications, and she unfortunately passed away. So it's just navigating things like that to help him, if he can't read his prescription bottles, how is he going to know what's what and what to take when? So for him, putting stuff in or his meds and adherence packaging works out. And, we also, things that are complicated are like Medicare coverage. So my husband actually became a licensed Medicare agent last year so that he can sit down with our Medicare age patients and help them really understand their plans each year and help them pick the best plans possible. Because even as a pharmacist, it's confusing to me, and if you don't spend time reviewing those plan changes every year, it's impossible. And imagine how hard it is for patients to look at all these different options that they got, people calling them left and right. So they know they can come to us. We'll look at their meds and help them pick really the best plan for them. And we also, I'm really big into education and knowledge sharing. So we do a lot of presentations locally, whether it's at retirement homes or there's a local Parkinson's support group. just several different local groups that we will come and present on various topics, whatever they're interested in, whether it's vaccine guideline changes or Medicare information, supplement information, just to help those patients kind of get the information that they need to help them better take care of themselves.
So you're also reaching out to other local organizations and healthcare providers to also do education as well.
Yes, exactly.
Yeah, I think the Medicare one is really interesting because if you're not in the know, you're not really paying attention to it, especially someone that's in an older generation and, I guess senior citizens who aren't going to really know the ins and outs and the changes that's happening. They probably just go to a pharmacy or doctor and they think that everything's a status quo until it's not. And then they don't know. And then you have to sit down with them and explain it to them. And it's probably very hard for them to understand. So appreciate that you do that. Ken, you serve in your community on the local board of Boys and Girls Clubs in the area. What inspired you to get involved with that organization directly, and what have you been doing with the Boys and Girls Club in your community?
Well, actually, I got involved in the Boys and Girls Club probably about 8 years ago when I had a chance to visit one of the local Boys and Girls Club in my community, and I was just completely jaw-dropped about the sort of the impact that they have in that area.
Mm-hmm.
I have maybe about 400 to 500 kids that come through there, and they pay like maybe $50 a year, something crazy like that, and they get free meals, after school tutoring, they get bused to the school. They're getting exposure to all these things for an inner city kind of underserved community that I would never imagine would be possible. For example, they got a ship to the west side where they actually had sailing training certification for an inner city kid. I've never heard of that. And then they would be sponsored by the Dodgers, so they would have a full Dodger uniform, go into Dodger Stadium and do things. And they're getting exposure to things I never thought would be possible because I was a part of that community once upon a time. Mm-hmm. I was just so impressed. I just said, what can I do? How can I get involved with this? Do I donate? Do I give you time? Whatever. So they put me on the board of directors, and I've been on since. I worked with them very closely. As a matter of fact, my nonprofit now worked with the Boys and Girls Club to open a nonprofit pharmacy in the heart of East LA, Central LA, and we just opened it about a month ago. And it's tailored specifically to serving this community. So everybody there is Hispanic and lower income. And so there's about 600 to 800 families there that are in sort of almost a pharmacy desert type area. Yeah. And we're going out there to basically provide services, whatever they need. And if there's assistance that's needed, it'll be funneled through the foundation to cover for that. It's been a wonderful partnership, to be honest with you. I mean, even the pharmacy itself, it says, powered by the Boys and Girls Club because we want to support them. And they have this campaign that's called the Kindness Campaign. So it's a pledge that's made to basically, and by the way, I'm so proud of this, of our Boys and Girls Club. It actually started this campaign for the whole Boys and Girls Club in the country, right? It's called the Kindness Campaign, and we are actually featured on the Rose Parade. I mean, crazy. Never a Boys and Girls Club been featured on the Rose Parade. So we're on there. Even at the time, the president, a few years ago, Biden came by to pledge his kindness in our club. It was crazy. Secret Service everywhere. It was amazing. And it was something that you never would dream of, right? Because of the impact that it did in that community. Now I think there's a bunch of course, and we're in Hollywood here in LA. So celebs now are all signing on. We want to do a kindness campaign across the country. We're actually flying everywhere. Not myself, but of course my club, and being a part of that, I claim a little bit of credit to be a part of that organization where we're going out there to spread, quote unquote, this concept of kindness, which I think is just awesome. And we're constantly doing things like that. And we, like, just a couple months ago, hosted a Kindness Carnival, which is completely free. It's a couple hundred kids that came in, completely free rides. There was like cotton candy, there was games, there was performances. It was pretty crazy, actually. And this was all just for the kids.
No, I love that. I think, it's one thing the world needs more and more of with each passing day is kindness. So I love that. And I'm going to stay with you real quick because, obviously, Jessi, I want to get your take on this because both of you have empowered not only your patients, but also your pharmacy staff to serve the community beyond your pharmacy walls. Ken, you had mentioned about mobilizing other pharmacists and providers in the area to care for the homeless, unhoused patients. Tell me a little bit more how you and your colleagues have gotten together to improve the health and quality of life for these patients, and really empowering your staff to get involved as well. How have you done that?
Well, I think it's not. I mean, none of this can happen in isolation. Nobody can do this alone. I mean, as one, there's only so much impact we can have, but as a team, then we can do a lot. So I'm very proud of my team. There's pharmacists that are very aligned in terms of our desire to serve that community. We come together and we do a lot of good work, whether it's through the foundation or through our nonprofit or even day to day at our stores. I think that they, are pretty much on a regular list of folks that go out on a month-to-month basis to go to community health centers, adult daycare centers, to do presentations, to talk about health, to provide access. In addition to, of course, the what we call street medicine, walking on the streets, which we are a little cautious about that, to be honest, just because it is a little bit dangerous. It is the streets, and it's not as dangerous as you think, but it's still a little bit. We have to be careful because a lot of folks do suffer from mental health issues and whatnot, and we do carry a lot of medications and things like that. So we're just very cautious about that, but we still try to get as much of our pharmacists as well as our students as well, because we have a lot of interns and we have a lot of working relationships with the various universities in Southern California. So they also get a part and engaged in that process. So I think it's just more of spreading the word and providing opportunities. I think everyone genuinely wants to help. They just don't know how to. So when you provide the platform and you provide sign-in sheets and you provide all these different events, then they'll just sign up. I mean, it's just kind of it's almost like, quote unquote kindness, right? You start seeing it, you start feeling it, you start seeing the impact, and you start doing it. It almost becomes commonplace and expected in our organization that you're going to be active in the community and you're going to have to do something to give back. So
yeah, that I actually volunteer here every month for the homeless and dropping off supplies and food and
Awesome.
a lot of different things like that. So that hits home for me, and you're completely right about it can be dangerous. There was a lot of mental health aspects of that can be very challenging. So I give you guys a lot of credit for doing that. Jessi, I want to shift it to you. How have you empowered your staff to serve the community beyond the pharmacy doors? You told a great story at RBC. We saw your story about how you helped during Hurricane. I'm sorry, was it Hurricane Irene? Yeah, Eileen, and we. So I know there was a huge call to action, but I think for that, I feel like your staff would just kind of mobilize and help. But how have you gotten your staff empowered and into getting I guess motivated with all these different things happening in today's healthcare landscape?
Yeah. So, as Ken said, your staff is so important, and we are so fortunate, and I am so thankful for our staff, because without them, we would not be where we are today. And so, especially our pharmacy technicians, it's hard work. And during COVID, that was a whole new challenge, but they came to work every day. They showed up, even though, they were putting themselves and their family at risk. But they also volunteered to learn new services. So our techs signed up to start doing COVID and flu testing. With COVID, techs can now become immunized certified. So it doesn't just have to be the pharmacist. And a number of our techs volunteered to take that course and become certified to be able to give shots. And, they still help us with that today. And last year, we got a couple of really large state-run facilities in our town to give all of their flu shots for their employees. And our techs came with us, in those clinics. They start at 7 a.m, so you've got to be there about 6:40. And one of my techs actually just yesterday, he said, "Jessi, are we doing the clinics again this year? I'd be happy to help, happy to get up and meet me at 6:45 in the morning." And I think, it's just because they know that they're providing this extra service for our community. And And also, they're doing more than just putting pills in a bottle. And so, I think it helps them to be a little more fulfilled. And we're part of a national organization called CPSN, and there's a lot of additional, outside of filling opportunities. And one of them is to do a health risk assessment survey with patients. And I have someone who is a cashier, and she loves doing them. And so it's basically just identifying needs that patients have, whether it's transportation, housing, anything like that, and connecting them to local resources. And so just all of our staff loves being able to kind of go above and beyond for our patients and our community, which I love.
Yeah, I love that. I love that your staff is already just, volunteering. Let's do this. I'm ready.
Yeah.
That means you definitely have a great staff that's buying into all the great things that you're doing. I do want to shift the conversation because, Jessi, you had brought up, being involved at for pharmacy advocacy, state, local levels, the different things that you're doing behind the scenes to help advocate for independent pharmacies. For each of you, what has your involvement been at the pharmacy advocacy level, either the state or national? Jessi, I'll start with you.
Yeah, so I think my kind of roundabout way into community pharmacy gave me a bit of an advantage on the legislative front because, whereas my parents, the PBMs, they just kind of started getting used to every new thing that they did, all the abuses that they were doing. Whereas with me, I just came in all at once and saw everything all at once that PBMs were doing, like DIR fees and that kind of thing. And when we took over, we were like, this is absurd. Like, there's no way this can be legal. Just seeing all these losses. So I just, with my previous job, I was used to working all the time. So with here, I got home and I didn't have anything to do. So I'd start, sending off emails, filing complaints on the North Carolina Department of Insurance website, anything I could think of, because I was like, this has got to stop. This is not right. And this is going to put us out of business. And so through all that complaining, one of our state representatives got my information, and actually I remember it very clearly. We are on the shuttle bus going to RBC in Vegas. And he called me, and I was like shocked. I was kind of like, fangirl at that time. Like, oh my gosh, the state representative is calling me on my cell phone. But he's basically just asked if I'd be interested in joining this committee that was trying to get PBM reform passed in North Carolina. And I was like, absolutely. So that's how it kind of started. And I've just been involved ever since, just trying to reach out to legislators, make them aware, get changes to happen. And I've learned a lot during this process and, learned that it takes time. And we were fortunate in North Carolina after, RBC was, I don't know, several years ago, right? In Vegas.
Yep.
So finally this summer, we got a PBM bill passed in North Carolina. So after years and years of fighting for it, it doesn't have everything that we'd like, but it's a starting point. And so, that's exciting. But we'll just continue to fight. And on a federal level, it's a little bit harder. It's a little bit slower. But I always am taking the opportunity to reach out. We finally had one of our federal representatives, Congressman Tim Moore, visit our store a couple of weeks ago. And I've been asking our federal reps to come to the store for a few years. So that was exciting. I finally got him to agree. But I just spend a lot of time reaching out to them, advocating, taking any little opportunity I can. Like during Hurricane Helene, we got an audit by one of the big three. And, a lot of stores in our area didn't have power. So it was amazing we even got the fax to come through. But I just took that opportunity to send that to all our state reps to be like, hey, we're in the middle of a natural disaster. We're writing emergency scripts. We're sending meds and Chinook helicopters up to even further Western North Carolina for patients that are without everything. And, we don't have water and power at home. And this PBM is auditing us, like the audacity of it. and I've never gotten so many responses from my state rep. So, yeah, it's just taking the opportunity to make sure that they know, because if you don't fight for your business, no one else is going to. And that's what I learned when taking over the pharmacy, because the PBMs make everything so complicated.
Yeah.
The state and federal reps, I mean, now they're starting to understand, but they're not going to know it like you do.
Yeah, getting audited during a hurricane situation, that's as low as it gets, to be honest.
Yeah, and you know, so I in my frustration, because they actually did it 2 days in a row. In my frustration, I took a picture and I put it on this like independent owners group, and then someone took it and shared it, and it got shared and went kind of viral. So this PBM, they actually ended up calling the store, and I saw it on the caller ID, and I was like, oh my gosh, they're going to end our contract, you know, because they can do whatever they want.
Wow.
But yeah, so I was very nervous, but when I took the phone call, she said that they were ending the audit, like not just for us, but for every Hurricane Helene impacted store across several states. But the reason she gave me was not because you're in the middle of a natural disaster, or, you know, we know that your staff is stressed, your community is stressed. The reason she gave me is because that they were getting blasted on social media.
Yeah. I mean, then that's the type of stuff it takes to get their attention, right?
Yeah.
Unfortunately, you have to, you know, leap those hurdles, jump through those hoops to make stuff like that happen. But it does get noticed, so there is an impact. Ken, from your insight, where are you at? I know you do a lot with advocating for pharmacists, especially at a state and national level. Where do you stand right now as far as what your involvement is, and what successes have you seen, and some of the lessons that you can give and provide to other pharmacists that may be a little gun shy about getting into advocacy on a state or national level?
I will say this. I mean, I think that sometimes we underestimate what we can do as individuals. I really do feel that until you've felt the power of, of making impact and making change, you don't really know that you're able to do these things. So I think really I've been, obviously involved with advocacy for a long time. And so I think the one thing that maybe I could share is like during my time as president of the California Pharmacists Association, we were challenged by the state in terms of massive Medi-Cal cuts at the time. And I remember having just a dinner with a few of my members, and they were just complaining. They're saying they're going to sue, they're going to do all these things. And I was like, hey, just calm down, guys. We really need to work together. We want to make any type of impact. If you do this alone, you do this alone, you do this alone, nothing's going to happen. And they're like, well, they never do, nothing happens. So I was like, well, why don't we wait? So we actually gathered them. I went back to the board and I was like, hey, I need an emergency meeting. Let's go and see if we can get everyone to band together, and maybe we can either pursue legal action or legislative action against the state to ensure that these massive cuts were not being done. So long short of it is that the legal came back and said, hey, we're going to do this. We need like $1.5 million. Okay, Ken, this is ridiculous. We've never done this. We've only raised $100,000 or $200,000 in the history of our organization, even as large as the California Pharmacy Association was. And I think it was like 300 at one point for one of our efforts. And they go, it won't work. And I was like, hey, give me some time. What if I can amass $1.5 million for us to do this campaign? And they're like, that's impossible. I was like, well, as a president, give me a chance. If I can't, then we can call it off. And so they go, sure. And then from there, we went on town halls. I remember going out to talk to everyone and everything. And before we know it, we'd raised $1.5 million, which was never heard of. And then we were able to mount a huge legal as well as a whole entire legislative, almost a blacklist campaign against the state. And then the crazy thing is that they actually came back and said, hey, you guys are making this look super bad. How can we get you to stop suing us? Well, you know what? You got to forgive this $250 million take back. Yeah. And they go, oh, that's too much. It's out of our budget, blah, blah, blah. They went back and forth. And so we were like, okay, well, here's the deal. This campaign actually involves the take back from Medi-Cal, but it also involves the chains and everything. And they said, okay, well, I was like, what if you take out the chains? They took out the chains. They're like, oh, it's $160 million towards independent pharmacies. I was like, okay, we can handle $160 million. Can you just take that? And they go, are you okay with that? I was like, yeah, because the chains didn't participate in our campaign. They didn't donate anything, so you can leave them out. I don't care. And they go, all right, a deal. So if you're willing to do that, we'll drop this cut, and in exchange, you guys drop your legal and all your negative campaign ads against us. I said, okay. And we actually got $160 million, okay, of independent pharmacy money, which would bankrupt probably about 50% of us, reclaimed, which was unbelievable. That was probably the most amazing feeling I've ever had, and that, empowerment of thinking that we can make a difference and we could really make a change. So, and then of course I was able to, continue that, being the VP at NCPA now on a more federal national level. And recently we're working on obviously the new PBM Reform Act. We've had a couple of shots at this and weren't very successful. So now it happened that very fortunate that one of the Congressman, Derek Tran, is actually in Southern California and happens to be someone in my district or around my district. And now we're very good, close friends. As a matter of fact, I was able to get invited to his inauguration in DC. Actually happened to be on the same flight with him. It's just all random, but how things happen in life. And now we're supporting him in multiple ways. And of course, he's going to be a sponsor of this PBM Reform Act that will hopefully provide some level of payment structure for us on a more national front. And so I just think that it's very empowering. And I think that it's unfortunately a necessary evil now that we need to participate. I hate politics, but I do feel that we need to fight for what is ours and what is rightfully appropriate for all the work that we do for our team members and for our patients. So I think it's something that you understand as a part of the job. If you don't stand up for your rights, like what Jessi's done, I think it's absolutely amazing. Because, she was able to really showcase how bad some of these players are in the marketplace that is really putting us out of business and putting patients and access at risk. So from that front, I just think that, whether you like it or not, you got to embrace it. You got to do it. And you have to understand that any little work that you do can make an impact.
Yeah, from somebody that I knew a while back said it best, get into politics or get out of pharmacy, which I always thought was pretty poetic. Jessi, from your work within, during Hurricane Helene and everything you went through, this is really a question for both of you. What do you think, I did mention this earlier, but what are some little steps that you think independents can do to start getting involved if they haven't been involved yet? I think getting started is kind of the main thing, because Jessi, to your point, once those doors open and you start getting involved, you start really seeing the impact you can make. And from what Ken said, strength in numbers, people coming together, you're stronger than you think you are. So Jessi, what advice can you give?
Yeah, and are you talking about legislatively?
Correct.
Yeah. So the one thing that every pharmacy owner should do right now today, if they haven't, is reach out to your local reps, your state level reps. Just shoot them an email, give them a phone call, both, and invite them to your store. It's so easy. And that's really one of the ways that I got started too. And so once they come in, and you don't have to prepare anything, which actually NCPA has a ton of great resources on their website. But once they come in and they see your store and they see you greet patients by name, and they see how different you are from chain pharmacies, they will understand the importance of fighting to keep you open and fighting for PBM reform. So just kind of that firsthand experience, and then also just building a relationship with them too is so important. So I know both of my local reps, and I think they've gotten tired of all my constant emailing and phone calls. But they both were sponsors on our PBM bill in North Carolina. And they're not going to do that if they don't know you and know the importance of it. And that's such an easy way to get started.
Ken, what about you?
I think pretty much similar. I mean, I think Jessi kind of summarized it pretty well. I mean, there's so many different ways to get involved. I mean, I think that, maybe another way is to get involved in a local association on the state level, right? Mm-hmm. Low level like entry, and they always have some advocacy leg or front, and you might just be able to just squeeze right in and follow along suit in terms of what is happening there. But local reps are a great way, because they are, they need your votes. And so, of course, they are much more willing to listen on what your thoughts and your needs are, or your concerns are. But there's just so many ways. It's not as hard as everyone thinks, because at the end of the day, you know, we do have to represent ourselves, because if you're going to wait for someone else next to you or someone else to your left or right to do it, that might not ever happen. And then basically you just end up complaining about how difficult life is when you're not really doing anything to potentially make a change. So I think those are definitely two areas that I think, from a personal experience side, that I think has allowed me at least an entryway to feeling more comfortable about approaching either a legislator or a local representative, or maybe going and getting involved at the state association level, because those are both great channels to kind of serve as an intro to how your voice can mean something.
Well said. Okay, so final question for each of you. Ken, I'll start with you. Within the next year, how are you most excited to serve your community as an independent pharmacist? What do you see coming in the near future, and what excites you? What lights your fire a little bit more?
I feel that, believe it or not, the profession is sort of changing. I think we're at a tipping point. I mean, believe it or not, I have actually a very positive outlook on pharmacy, despite some of my colleagues kind of thinking it's doom and gloom. I felt that I've been here long enough to know that things happen in cycles. And when things get really bad, it's also when it allows for things to get better. It's because now we're sort of at this point where things are pretty bad. I mean, probably as bad as it's been as far as I can remember as a pharmacist. And I do feel that it is a turning point. I think that when there's not much more you can give, that's when people start noticing and changing. That's when our voices get louder and patients, get more emotional and passionate about what they can do to keep us in business. I think it is an inflection point, and I think that's where I'm excited about, because it's almost like when I came out of school about 20 some years ago. I remember that it was almost like a golden age of pharmacy, where a lot of pharmacists were like, there's a shortage and people can find jobs everywhere, and they're very excited because they're getting bonuses. In my state, people were getting BMWs to sign on and sign on bonuses, and I feel that those times are sort of maybe coming back. The reason I say that is because if you look at the statistics, the next 3 to 4 years, there's actually a huge shortage of pharmacists coming out of school, but yet the job market is continuing to grow and expand. And also, as an independent pharmacist, I do feel that we're as close as we'll ever be to any meaningful PBM reform. I think many people have said this, and I'll continue to say it, and is that when I first started this journey, no one knew what a PBM was. Now everyone knows what a PBM was. When I go in there, that's all I wanted to talk about, but no one cared. And now when I go in there, I talk about other things. All they want to do is switch the topics to PBMs. So what that tells you is that we're at a point where it's just about to happen. We just have to be a little patient. We have to be a little consistent in our messaging, and just not stop fighting. And I feel that we're almost there at the brink of this revolution of change that will hopefully change how we do things as pharmacists, open up our abilities to serve the communities that we have worked so hard in all our years as pharmacists to serve. So I'm actually very excited, quite honestly.
No, that's great to hear, Ken. Great insight there too. Jessi, what about you?
Well, first, I love to hear Ken's optimism about PBMs. I'm hopeful that we can get something done, especially with the PBM Reform Act, because it is defeating over time. With continuing to fight these PBMs, but like Ken, I'm gonna keep fighting them. That's my passion on the side. But on a, community pharmacy front, I mentioned in North Carolina, we can do test and treat now for flu. So that's exciting for us. So, starting in less than a month, we can start writing scripts for Tamiflu. And so any new service that comes about, we jump on. And, it's just exciting to offer something different, explore something new. And so I'm excited to see where that takes us. We've also recently, earlier this year, became the first pharmacy in North Carolina to become certified for yellow fever vaccines. And we do travel vaccine consults too. So we have patients driving from like Asheville and Charlotte to get yellow fever vaccines. So it's just kind of fun to be able to do something different and offer unique services to our community. So at our pharmacy just keep exploring what additional services we can provide, especially with PCP shortages as those continue to grow.
Well, I think that's a great way to end this podcast. And for all of you listening, I think you could see why Jessi and Ken were nominated as Community Leadership Award finalists. I mean, you guys are absolutely incredible. Thank you so much. On behalf of Cardinal Health and everybody listening, I do want to say thanks again to Ken and Jessi for providing all these amazing insights and unique ways they're contributing to the overall success of independent pharmacists and caring for their communities. I hope all of you listening gain some great ideas and insights on how to get more involved and to keep advocating and fighting on how important independent pharmacy business owners are to each and every community. And to all of you, thanks for listening to today's episode of the Cardinal Health Counter Talk podcast. As a reminder, if this is your first time listening, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcast. See you on the next episode, and to everyone, take care.